Indomethacin is one of the medication that can be given to you to control the pain. It is classified as non-steroidal anti-inflammatory drug. It is available as capsules and it can be used in the various types of painful conditions as it reduces pain as well as inflammation associated with painful conditions. This medication can be used in the management of moderate to severe rheumatoid arthritis, one of the autoimmune disorder that affects the joints, resulting in inflammation, pain and stiffness. Indomethacin can reduce the inflammation as well as it can relieve the pain in rheumatoid arthritis. Another clinical indication of this medication is in the management of ankylosing spondylitis. It is a chronic inflammatory disorder that mainly affects the bones that are connecting with the spine and pelvis. This may result in the development of back pain and stiffness, which is more troublesome during the night. It also restricts the spinal movement due to increased stiffness in the connecting bones. Again, to reduce the pain and inflammation, indomethacin can be used. Similarly, this medication can be used in the management of osteoarthritis. It is one of the age-related degenerative joint disorder that results in the breakdown of cartilage due to wear and tear, and it produces joint pain, stiffness and swelling. For symptomatic relief, again indomethacin can be used in this condition. But before using this medication, we should know important facts about indomethacin. What is its effect on kidneys? What happens when it is used for long term on your eye? How it affects the liver functionality? What is its effect on bleeding process? All such things are very important to know. So in this video, let us discuss the key facts of indomethacin. First of all, let us see how this medication works. Indomethacin is a non-steroidal anti-inflammatory drug. Non-steroidal indicates this medication is not having the steroidal ring. Therefore, it is not acting like opioid analgesics. Most of the actions of indomethacin are peripherally produced and it mainly reduces the pain sensation and inflammation at the periphery. Many of the inflammatory mediators are involved in induction of pain sensation and inflammation. However, among them, prostaglandins play an important role. These prostaglandins are synthesized from the COX pathway. This pathway includes two types of enzymes, COX-1 and COX-2. The COX-2 is the inducive enzyme which is going to be more induced during the inflammation, and it generates prostaglandins from arachidonic acid. These prostaglandins can increase the pain sensation, inflammation and swelling. Now, indomethacin can block this COX pathway, thereby can reduce synthesis of prostaglandins. This can reduce the pain and inflammation. Apart from these actions, indomethacin can also reduce the release of pro-inflammatory mediators, and it also inhibits the chemotaxis, the movement of chemicals towards the site of inflammation. By all these actions, indomethacin can reduce inflammation and pain sensation. Now let us the important precautions of this medication. Long-term use of this medication can impair the renal functionality. Particularly, it can produce renal toxicity. Renal prostaglandins play an important role in maintaining the renal perfusion. When NSAIDs are going to be used, this renal prostaglandin synthesis is going to be inhibited. This results in impaired renal perfusion. So when these NSAIDs are used for prolonged treatment at higher doses, they may cause renal toxicity. They can reduce both renal blood flow as well as renal perfusion. Few of the risk factors can further increase the renal toxicity. Particularly in people with impaired renal function, this medication can further increase the renal toxicity. People with severe dehydration or having low body volume can also have the increased risk of renal toxicity. We have the other risk factors like liver dysfunction or pre-existing heart failure can also increase the risk of developing renal toxicity. A few other medications like diuretics, ACE inhibitors and angiotensin receptor blockers can also increase the risk when they are combined with this medication. Therefore, in people with pre-existing kidney disease, this medication should be carefully used. However, in advanced renal disease, this medication should be avoided as it significantly reduces the renal function. That's why it is highly recommended that When this medication is indicated for longer periods, the renal functionality should be regularly checked. Another effect of this medication is on the eye. It can produce few of the corneal deposits, and it can also produce retinal disturbances. This may result in blurred vision. Therefore, in case of any visual disturbances, an ophthalmic examination should be done in order to assess the effect of this medication on the eye. The next one is the hepatotoxicity. It can elevate the liver enzymes like ALT and AST, alanine transaminase and aspartate transaminase. These liver enzymes can be elevated up to 3 times higher than the upper normal limit. It may significantly affect the functionality of the liver. This hepatotoxicity can produce few warning symptoms like nausea, fatigue, diarrhea, skin rashes, and upper right abdominal pain. It can also develop into jaundice, leading to yellowish skin and eyes. People may have flu-like symptoms. In a few people, systemic manifestations can also be observed, leading to eosinophilia and skin rashes. If you observe such symptoms, it may indicate hepatotoxicity. In such cases, this medication should be immediately stopped. This medication can increase the potassium levels, leading to hyperkalemia. This may be observed in people even without any renal impairment. So, even though renal function is normal, the potassium levels may be elevated. That's why whenever you are taking potassium sparing diuretics like amiloride, triamterene or spironolactone, the risk of hyperkalemia may be more pronounced. This medication can increase the risk of few cardiovascular complications. It can increase the thrombotic events that may induce the development of myocardial infarction or stroke. In order to avoid such serious reactions, this medication should be used at the lowest dose possible. Generally, aspirin can reduce the cardiovascular complications. It acts as antiplatelet agent, thereby it can reduce the formation of thrombus, the abnormal clot in the arteries. However, the addition of aspirin along with NSAIDs has no benefit in reducing these cardiovascular complications. Instead, it may increase the gastrointestinal side effects by combining with aspirin. Another important aspect is the increased risk of bleeding. This drug can inhibit platelet aggregation. This may increase the risk of bleeding, particularly gastric bleeding. This is more important in people with pre-existing gastrointestinal disorders. Therefore, in people with duodenal, gastric or peptic ulcers, the risk of bleeding is further increased. In people with few of the inflammatory disorders like ulcerative colitis, it increases the risk of gastrointestinal bleeding. This may be more troublesome when other medications like aspirin or anticoagulants like warfarin are used. This medication can produce few of the adverse reactions on your skin. It can produce few skin rashes. It can also produce exfoliative dermatitis. Even though rare, it can produce a serious condition called Stevens-Johnson syndrome. It produces skin rashes, body pains, blisters on the skin, as well as development of fever. It is a fatal condition that should be immediately monitored. In people with pre-existing skin disorders, skin exfoliations may be increased. What are the side effects? Indomethacin mainly produces few side effects on the renal and hepatic system. It may produce a temporary renal insufficiency, and it can also increase the liver enzymes and may develop the symptoms of jaundice. Few other side effects like headache, dizziness, and somnolence can also be observed. It can affect the gastric system, leading to epigastric pain, indigestion, bloating, abdominal cramps. In order to reduce these gastrointestinal side effects, Indomethacin can be taken along with food. Now let's see the dosage of this medication. Indomethacin is available as capsules at a strength of 25 mg and 50 mg. It is also available as extended release capsules at a single strength of 75 mg. Even it is available as oral suspension and powder for injection. For treating inflammatory and rheumatoid disorders, Indomethacin extended release capsules works better. They can be given at a dose of 75 to 150 mg per day. That means they can be taken as a single dose or 2 doses per day based on the requirement. In case of immediate release tablets, each dose may be variable from 25 to 50 mg, given 2 to 3 times per day. Indomethacin capsule should be taken with food in order to reduce the gastrointestinal side effects. Otherwise, it can be taken with a full glass of water to minimize gastric side effects. So that's all about this medication, Indomethacin. I hope this video is useful to you. If you really like this video, please subscribe to our channel and share this video with your friends. Post your comments in the comment box. Thanks for watching. See you in the next video.